Greetings from Advanced Fertility. I'm Dr. Kaberi Banerjee, and today we will discuss a very important topic of low AMH. Now, many of us are seeing more and more patients of low AMH. Now, today we will discuss what is low AMH and how we can treat it. AMH means anti-Mullerian hormone. The anti-Mullerian hormone is secreted by the early antral or pre-antral follicles of the ovary. Now, what does that mean? As we know that in a female, the total number of eggs is fixed. She is born with a certain number of eggs. When her periods start, it becomes about 100 million, and every month the eggs reduce till about the time of 38, 39, it's about 10,000 from 100 million. And by the time it's 50, there are no eggs. Now, every month there is one mature egg. But for that one mature egg to form about 20, 30 or more small eggs or antral, pre-antral follicles are recruited. And these, for the functioning of these hormones, AMH is needed. It is a protein and glycoprotein, mix of glycogen and protein hormone. It is produced in the early follicles of the ovary. It is used in the growth differentiation of the oocyte, which is important form of the menstrual cycle. It is used to assess the woman's egg reserve, and it can be done on any time of the menstrual cycle. The follicle stimulating hormone FSH, LH, estradiol testing are all done in the early part of the period, day 1 or day 2, but AMH can be done anytime. That's a big advantage. Now, what are the normal levels of AMH? Usually, the normal range is between 1 to 3.5. And then it reduces to 0.3 to 0.9. That is the low levels. And very low are less than 3.3. The high levels are more than 0.3, and women with polycystic ovaries have such levels. So if your level is around 2, then we are happy. If it is less than 1, it is something really to be concerned about. And we are getting many patients in this group nowadays. As we know, AMH is age dependent, and as your age is increasing, your AMH is reducing. Now, these may not be the exact levels at each age, but these are the average. It can be slightly less or slightly more, but yes, as the age increases, AMH levels normally reduce because the total number of follicles is normally reducing, and therefore the hormone secreted is less, and therefore the levels are also less. So what are the causes of low AMH? We have already discussed age. Now, certain conditions like endometriosis, sometimes it runs in the family with certain genetic illnesses. that the AMH reduces faster in some ladies, their sisters, their mothers. Then there are autoimmune conditions uh, which affect the endocrine glands like the ovaries, the thyroid, and the functioning reduces before time. And also, when you have to do cancer treatment, say of ovarian cancer, breast cancer, you need chemotherapy, radiotherapy, then your egg reserve reduces. Now, these cannot be changed, but there are certain factors that can be modified when you have low AMH. And if you prevent those things right from the beginning, the chances of having low AMH is reduced. Like smoking, like environmental causes. It's not very clear, but in the cities, we are seeing women with low AMH more than what we used to earlier. Is it because of the stress, the pollution, the Wi-Fi? We don't know. Studies are ongoing. Obesity is a big reason. Birth control pills can falsely lower your AMH levels. Taking injections, certain Lupron can also lower your injections. If you need an ovarian surgery, it has to be done properly so that unnecessary shearing or removing of normal oocytes is avoided. So how do we treat low AMH? It consists of lifestyle modifications, taking certain vitamins and supplements, choosing the optimum fertility option, and choosing the right IVF stimulation protocol. Now, regarding your lifestyle, a good diet is very, very important. Less carbohydrates, less fat, more of protein, more of green vegetables, fruits, the antioxidants, less of fast food, almost no junk food. Exercise. In today's era of being on your gadgets all the time, many women in the cities are not doing the minimum exercise that is needed. So at least 45 minutes of some form of moderate exercise at least 3 to 4 times a week is necessary. Yoga is an excellent form of de-stressing and keeping your body fit. Smoking and alcohol are a complete no-no when you're considering fertility treatment, especially with low AMH. Also, when you're preparing for your fertility treatment, you should know that yes, there is a problem. There may be methods that will help us, but no treatment is 100%. So keep your expectations right and avoid negativity during the treatment. There are certain preparations, vitamins that have been known to help women with low AMH. Now here I would like to say that suppose your AMH level is zero point 0.7 nanograms per milliliter. It can also be measured in picograms per milliliters, where you multiply it by a factor of 7. Now suppose it's zero point 0.7 and you start all your medicines, suddenly it will not become 2, even after 3 months or 6 months. It may become 1. After 2 to 3 months, it may not become. So this conception that let me take medicines and improve my AMH is a misnomer. Because the total number of eggs is fixed, we can improve it slightly, but not drastically. And waiting unnecessarily on vitamins and reducing your AMH further is also not a good option. But while you're preparing for the treatment, folic acid supplementation, multivitamins like zinc and selenium, vitamin D, fish oil, and coenzyme Q have been known to improve AMH levels. Vitamin D especially has been associated with certain factors which directly improve AMH levels, though there are some studies that prove otherwise. Coenzyme Q is also a good antioxidant that has been associated with improving AMH levels. Now, giving some form of testosterone has also been associated with improving AMH levels. Dehydroepiandrosterone, 75 milligram daily for 2 to 3 months. Testosterone gel applications for 1 to 2 months. Growth hormone supplementation, especially during the stimulation cycle. When you start your stimulation, giving estrogens in the prior cycle have also been associated with good response. Now, does having a low AMH always mean that you need IVF? No. Natural conception, IUI, IVF, donor egg, surrogacy, adoption, these are all fertility options that are available. Low AMH does not mean you will not conceive, especially the younger population. It just increases the radar where you feel that we should not wait too long. But in older, it has a much worse prognosis, and definitely we need to take actions quicker. Now you have decided to start your IVF cycle. You need to visit your doctor. She'll do your test. She'll do an ultrasound. Now, AMH is a test of the laboratory. Nowadays, the ELISA testing kit are quite standardized and levels are quite reliable. But sometimes, even now, we get that, oh, the ultrasound shows smaller follicles, but her AMH is high, and vice versa. So always doing an ultrasound and checking the small follicles by an experienced doctor is very, very important adjunct to your diagnosis and treatment. Discuss the realistic chances of pregnancies. A 43-year-old with an AMH of 0.01 is almost 1% or 2% or almost 0%. But a 35-year-old with an AMH of 0.8 has significant chances of pregnancy. So discuss these factors right in the beginning. Now, what are the various stimulation protocols to give the best yield of eggs? Sometimes the stimulation is started on day 1, day 2, and some antagonist injections are added on day 6, day 7. Sometimes it's called a flare protocol, ultra short flare protocol. There's a long protocol where you start before your period starts. Now, all studies have shown that it really does not make too much of difference. No protocol has been shown to be much, much better than any other. But yes, you can vary from cycle to cycle, patient to patient. Suppose you've tried an antagonist protocol and I have seen that the response is not as good. I will try a long protocol next cycle. And sometimes we do get better response. Choose the right dose of stimulation. Sometimes low dose works, but definitely too high dose is not a good idea. We choose dose between about 300 to 375 IUs, international unit, and combine FSH and HMG to give the best response. There has also been the study of duostimulation, where in the same cycle you stimulate twice, follicular phase and luteal phase, to get more eggs in a short period of time. This is usually used for couples or ladies who are going in for, say, cancer treatment. They don't have much time. Still in the experimental phase in many clinics. It can be tried, but if you have time in your hand, we would prefer embryo pooling with multiple cycle stimulation in the follicular phase because that is time tested. Another thing that we need to know is that when you have low AMH, you may see 4-5 follicles with good stimulation, but that does not mean 5 embryos. It may mean that you got 4 eggs, out of which 3 are mature. Maybe all 3 are fertilized if you're lucky. 1 or 2 are good embryos. So You need to know that there is a fertility pyramid. Follicles, if you see 4-5 follicles, you may get 1 to 2 good embryos, right? Younger women have a much better chance of conception than older with low AMH. And we have seen that when we do embryo pooling, multiple cycle stimulation, in the younger women especially, we see better response in consequent cycle and good pregnancy rates, almost in the range of 30 to 40%. So, just to sum up what we said so far, if you have low AMH, prepare your body well. Change the lifestyle parameters which you think are wrong. Take the correct supplements, vitamin D, folic acid, CoQ10, DHEA, stimulation protocol, antagonist, agonist. If you don't have much time, duo stimulation, multiple stimulations if necessary. Needless to say, your lab has to be fantastic. The IVF laboratory, because you're getting just a few eggs. So those eggs have to be treated very well to give us the good embryos. We believe in early transfer in women with low AMH. There's a lot of data on the net about blastocyst being better, but blastocyst is not always better. If you have fewer embryos, early transfer is better. And needless to say, the endometrium has to be prepared well, the transfer technique has to be excellent for us to give you the result. In all this, we must not ignore the male factor. The chance of pregnancy is 50-50%. The sperms also have to be good. So a good diet, exercising, stopping smoking and alcohol, supplements should be added. For low AMH, poor egg reserve, there's a lot of experimental study, platelet-rich plasma infusion, stem cell, mitochondrial transfer, ovarian transplantation. But these are all experimental and we are not using it routinely in day-to-day practice. We hope that in the next few years, something positive will come up and we'll have a robust treatment for women who are suffering from this problem. So at our center, at Advanced Fertility Center, we make it very clear that we do not exclude patients for treatment just on the basis of AMH. Younger women do better. Multiple cycles sometimes leads to better egg numbers. Antagonist and long protocol or the agonist protocol both work well. Embryo pooling can be helpful. Early transfer and routine PGS, especially in the older, there's this question, are you going to check my embryos before you transfer? Well, no, probably not, because if you've got only few embryos, then you make them go to blastocyst, then you biopsy, then you freeze, and then you transfer. Probably will not get much embryos to transfer. Also, PGS is not 100%. Normal embryos, normal tested embryos can also lead to defects, abnormal can also lead to normal. So this is still very much controversial. I'd rather invest the money in doing multiple cycles and getting the pregnancy and then do an amnio or a nifty test on the baby to rule out any defects. Also in all this, we should not get carried away. We should definitely know when to stop. For me, 3-cycle stimulation is max. For those with very, very low AMH who are very, very keen, I'll do a response to stimulation, give high dose and see whether she's responding or not. And if she's not responding, just stop. Egg donation is a wonderful option. In one of my next YouTube videos, I'm going to talk all about it. Lot of myths, lot of apprehensions. But yes, it is the definite way of helping women with low AMH after all these have not worked out. So I would like to say that again, low AMH does not mean you can't get pregnant. IVF is not the only option, but it's probably the best and it should be started early. You have to be realistic about the expectations. We need to optimize all aspects of the treatment. Younger women, women with endometriosis, etc., may have better outcomes than others. The other options, stem cells, etc., are experimental. So thank you very much. And if you have any questions, please leave it in the comments.